the Deputy General Supervisor, National Guard Hospitals and Primary Care in the Holy Sites. Dr. Saleh, I want to welcome you to this live coverage. And first of all, كل عام وانتم بخير. And second, could you give us elaboration about the role of the primary care and the National Guard hospitals in the health concerns over the pilgrims who come to the holy sites?
بسم الله الرحمن الرحيم والصلاة والسلام على رسول الله صلى الله عليه وسلم. I would like to thank the second channel, Saudi second channel, for inviting me. The second thing is about the National Guard at Hajj. Actually, the National Guard since many years are sharing and helping in Hajj mission every year, and we start actually by opening one hospital called Mina Hospital, or Emergency Mina Hospital for the National Guard at Mina, and that hospital is well equipped. We have around 30 beds in that hospital, and also 6 general and general clinics and specialized clinic. We have also a dental clinic in that hospital, and this hospital is open to serve all the pilgrims with the National Guard guests. Of course, as all the other sectors of the health affairs, as you know, the treatment is free. This hospital, this year, we add to it also place 2 beds at male side and 2 beds at female sides for sunstroke and heat exhaustion. As we know that the weather this year is maybe a little bit the fever.
It's very hot actually.
It's very hot.
The temperature is above 45 degrees Celsius.
It is. And also this hospital has a backup from our King Abdul Aziz Medical City in Jeddah, because all the doctors and nurses, pharmacists are coming from that medical city, and it's actually our backup. This is for Mina. In the meantime, we have another hospital at Arafat called Arafat Hospital, and it is around 20 beds for male also and females. And we have 2 primary cares, one at Muzdalifah, and that is around only 2 clinics, and the other one is at Sharaya, and we have this Sharaya Primary Health Care Center. It's actually all over the year is helping the National Guard families living at Mecca. At Hajj, it works over the 24 hours to help the National Guard forces, which is help which help with the others government sectors in the Hajj mission.
So, Doctor, we have 2 main hospitals, one in Mina Holy Site, one in Arafah Holy Site. We have 30 clinics here in Mina, along with 2 in Muzdalifah, and this is and the Sharaya.
And the Sharaya primary care.
And the Sharaya works all the year, but those are mobile hospitals. Some of them are mobile clinics.
Yes. In Arafat and in Mina, they are not mobile. They are actually work at the time
permanent
of
hospitals.
For Hajj, a permanent hospital. But in Muzdalifah, it is mobile clinics. As Sharaya is, as I said, it is permanent Sharaya, and it's very modern actually primary health care center.
Over many years, the National Guard institution have supported all the other forces and all the other government-related bodies in many aspects, especially in the healthcare as we are talking about. Dr. Saleh, also, And we were speaking about a while ago with the general director of prevention, and he said there is no epidemic diseases this year, alhamdulillah, thanks Almighty God, as well. But yesterday there was an unfortunate incident that happened where the pilgrims stampede each other, and which resulted in the deaths and the injuries of others. Maybe 865 were hurt and injured. What was the role of the National Guard medical services in this incident?
In the beginning, this is a very sad what has been happened. The National Guard is actually share every year with 10 medical emergency groups with the Ministry of Health and other government health sectors. And this year, when we know about the accident, actually we raised our 10 groups to 17 medical groups, and each group is consistent of ambulance and 2 doctors and a nurse and 8 men. And we share at the site of the accident by making a triage for the patients. We treat some of the patient in the area. At the site. We transfer some or the majority of the patient to the Ministry of Health hospital inside Mina, and also we send some of our to our hospitals here in Mina, trying to help these people, unfortunately for this accident. In the meantime, we also now arrange transferring some of the patients here from the Ministry of Health hospital to our medical city, King Abdulaziz Medical City at Jeddah. We nearly transferring maybe around 18 to 20 patients to the ICU from here to our hospital in Jeddah. And also it is called King Khalid also, he's inside the medical city, and we are transferring now. We reach about 30 cases also transferred from the cold cases, so we just need simple things, and also we are going to carry on until we may reach to 100 cases. That's only to help the Ministry of Health, and also to help the pilgrims who are injured.
Doctor, now most of the people are concerned about the injured people. How healthy they are now after they get the treatment? Hopefully, God willing, they're all doing okay, because even the doctor said now they are recovering. Most of them are inshallah recovering. How could you secure the the families that waiting for the news from you? Could you tell them?
Well, as you know, that the patient who are still in the ICU, and they need times. The patient who are outside the hospital, outside the ICU and the general wards, I think they are improving, and some of them maybe has been discharged from the hospitals. And they are really doing fine, and I think they receive the best treatments, because as you know, our hospitals is in the international standard hospitals, and we take to our King Abdulaziz Medical City in Jeddah at King Khalid Hospital these patients who really needs special care, and we are inshallah maybe within other weeks or so they will be evaluated, and I think they are improvement. They are a big benefit in with this pilgrim.
Dr. Pavkir, how did you see the reaction of the health bodies after the incident? How did you react when you heard about the injured? The situation, the incident, the tragic incident. How fast? Because most of the pilgrims, they said that the ambulances reached there very fast and very quickly. How well are you prepared by your ambulances by your technical people, by your doctors. How alert were you during that incident?
Well, you know, the notification is coming from one side to all the to Ministry of Health and all the other government health affairs sectors. So when we have the notification that there is an accident, then we immediately send our first 10 groups. And then when we find that there is a lot of pilgrims or injured, we increase the number immediately by another 7 medical groups, and some of it we bring it from the medical city, King Abdul Aziz Medical City in Jeddah, and they start. You know, there are a specific plan, and it's usually headed by the Ministry of Health, and we are not the only one who's in the field. There is the Red Cross, there is the Ministry of Interior, there is the Ministry of Defense, there is, of course,
the Red Crescent, the Saudi Red Crescent.
Yes, Saudi Red Crescent. There is the Ministry of Health, of course, and they really manage
as
very
well as
quickly.
the Ministry of Defense is with you?
Of course, yes, of course. Ministry of Defense and Ministry of Interior and National Guard, ourselves, and the Ministry of Health. And this was supervised by the Ministry of Health. So, as you know, they distribute all of these groups all over the area, and there is a lot of ambulances, so they just make the triage, and according to the triage, what's the case? Is it we have different codes for the cases, and according to this,
you have reacted.
Yeah, we have reacted, yes.
Doctor, in number of personnel, approximately, the personnel of the health in the National Guard hospitals that are allocated nowadays within the holy sites, be it in Mina, in Arafah, in Muzdalifah, and around Mecca, the number of personnel.
Yeah, okay. The doctors, what we have is around 50 physicians coming from different specialties, and they are from level of consultants until resident, and we have around 35 to 40 nurses, male and females, and also we have technicians. So the whole total is around 120. Plus, we have also the military fields, National Guard department also with us. In the meantime, we have a specific department, as you mentioned in the beginning, about this infection and preventive control. We have a team which consists of about 3 consultants plus maybe another 6 or 10 technicians with them working for only to help in the preventive and to control infection. This year, alhamdulillah, even our hospital, we didn't have any cases reported as an infection from any of the viruses, including the respiratory viruses.
So we have now tomorrow, who's in a hurry can leave tomorrow, all the pilgrims, because it's the second day of Tashariq. Who wants to be delayed or to stay can stay till the day after tomorrow. Are we still prepared until
last? Oh yes, yes. We are here until all things is okay and safe. So we are staying until 13, sometime until 14, and
until all the pilgrims leave.
Until all the pilgrims leave.
And that's your mission.
That's our mission. Our mission is end by all the pilgrims leave Mina.
So you are the last people to leave Mina, most likely.
I mean, after, of course, the Ministry of Health, they have permanent hospital. They are
I know, but I'm saying the people who are in mission right now.
By mission,
you
yes.
leave after the last Hajj leave.
The last Hajj, by 13, midnight, something like that, or early morning, 14.
Dr. Saleh Pavkir, how do you how did you see the organization of the medical services that are provided? Each year there are developments. We can even perform surgeries, you can perform operations. So your concern is the health of all the pilgrims, whether they are from outside or from inside the Kingdom of Saudi Arabia. How well we are prepared for such incidents and how well you are ready to react to any incident that might happen.
Let
God
me
forbid.
to tell you, Saeed, actually there is a good and excellent coordination and cooperation by all the health sectors. And we have a meeting since few months before Hajj. Ministry of Health, National Guard Health Affairs, Interior
Ministry Health Affairs.
yes, and also the defense. See, all these sector healths has make a group, and they are coordinating with each other. They know what's in this hospital, what's in the National Guard hospital, and what is in the Ministry of Health and all the others. And also even this year, because as I told you, one of the most important things because of the hot weather is the heat stroke or heat stroke. So they make plans for this, and it will be found in the same hospital. How we treat these cases, you will find the same protocols. So it is all the hospitals here all the hospitals are really in higher standard. Maybe if I say to you to as the international one, and every year we are giving you new things, improving things, and it is now better than the years before. So the cooperation and the coordination with all the health sectors is excellent. So we will not find, if the Ministry of Health needs something from the National Guard, we found the National Guard is there.
Dr. Saleh pavkir, I know you are very busy. You have to go back to your hospital. Would you like to add anything before we end this interview to just to secure the pilgrims who are watching you, that there are people behind them, there are people supporting them, there are people will be ready to treat them at any center at any moment?
First, I will say what has happened about the accident is, alhamdulillah, what we could do. This is not by our hands. Unfortunate incidents. And I support, I could say to them that inshallah, who died, he will be inshallah in the bride, and I hope for the people, for the other pilgrims, that they will finish their Hajj in peaceful and return to their home safe after they are finishing the finished Hajj. And in the meantime, I would like to thank the custodian of
the two holy mosques.
Yes, the holy mosque, King Abdullah.
King Salman bin Abdul Aziz.
Sorry, King Salman bin Abdul Aziz. And inshallah things will be improving, and we are, according to his directive, we work as one team, and we work to help all the pilgrims.
Dr. Saleh Salem pavkir, the Deputy General Supervisor of the National Guard Hospitals and Primary Care in the Holy Sites, I want to thank you, sir, for joining me, and hoping to meet with you next year and the years after with better services provided for the pilgrims. And the viewers, as we heard it from Dr. Saleh pavkir, that all the services are rendered and provided for the pilgrims, for the safety and security. All the health bodies in the Kingdom of Saudi Arabia, be it in the National Guard, Ministry of Health, Ministry of Interior, and Ministry of Defense, are collective efforts, and there is a committee, as Dr. Saleh said, since early months before the Hajj, to coordinate their efforts together so better services can be rendered and provided for the health of the pilgrims, because that's the concern of the leadership of the government of Saudi Arabia, as well as the related bodies, also the Saudi people. Our coverage continues here on Saudi 2. Stay tuned with us.